everybody. Welcome to this special episode of Candid Conversations. So, we're here today at the Candid Conference. It's our 7th annual conference. The title is Focusing on Fit for the Future, the 10-year health plan and neurodevelopmental conditions. We've got around 300 people here today at the conference, including clinicians, academics, and people with lived experience, contributing to all kinds of discussions on the future of neurodevelopmental and intellectual disability services. We're really lucky to have Dr Ken Courtenay here with us, who's National Clinical Director for Autism and Learning Disability at NHS England and Honorary Clinical Lecturer at UCL. So Ken has very kindly joined us to do a quick podcast with you all, just to reflect on how he's finding the conference and some of the speakers that we've been listening to this morning.
Can I just say that it's a real pleasure to be here at the conference. I've attended all of them since the first year, which has been incredible for me, that is. What I really like about the conference overall is just the inclusion of people with learning disability and autistic people in the running of the conference, but also in the themes as well. So very often, we come along to these conferences with other clinicians in the room and discuss great things and great important and lofty things, which is fine. But when you bring the people at the receiving end of everything that we're meant to be talking about into the room, it changes the balance, it changes the dynamic for the better. And it gives real meaning to what's actually going on and what we're doing as well. And there's an element of feedback you get from people in the room, which is really important for us to learn about. And in terms of this conference, you've continued to do that and even better this time as well. And what I've noticed as well is that the people who with lived experience who've been coming along for a number of years, they're now saying that they feel more a part of it. I mean, that is a great reflection, is a great compliment, and for me, in some ways, a measure of success for what you've achieved today. I'm really hoping that this is number 7. It's not going to be the last. There's going to be more happening because a lot more needs to be done in working with people, co-producing, co-creating, doing all the co's. But as somebody has said, to get rid of the co and just do the research without having to think about, oh, we must include people. They will be there naturally. Anyway, and that's one of the benefits I've drawn from it myself is that thinking in the various work I do. From a personal point of view, in terms of my work, what I really like is that colleagues from these organisations like NHS England are taking part. And I think, again, that's another measure of success is that you've got the eye of people at a higher level, whether it's NHS England, whether it's more Department of Health. And that is very important. A testament to that is the kind of speakers who wanted to come and speak today, parliamentarians who want to actually engage with what you're doing because you want to engage with them. And this is for me, is the big strength of CANDDID. Can I just say as well that you are a regional body, but you have great potential to do a lot more as well on behalf of autistic people with learning disabilities and their families. So well done, and may it long continue.
Oh, that was really good to hear, Ken. So, for those of you who don't know me, I'm Maddy. I am an associate director at CWP, which hosts CANDDID, and I'm the senior manager involved in CANDDID. You were talking earlier about co-production, Ken, and I had the honour of listening to a co-production team talk in one of the seminars earlier today. So we had a group of individuals from Autism Together who are co-designing, co-creating and co-researching an IHR project called Unlocking Excellence. And we heard from them in the seminar about how they had been involved in designing, tweaking and delivering the project, which involves them interviewing people with learning disabilities about their experience. and how they've been involved in designing the analysis of that project as well, how they'd really enjoyed thinking about how they could do the analysis, exploring different options for that, and then selecting one. And what really came across in that was the importance of people with lived experience setting the research questions, and then people with lived experience actually interviewing other people about their experience of services. One of the reflections that was shared with me at the end of that seminar was that the quality of the involvement and the engagement of participants in that research was better because they felt comfortable talking about their experience with people who had experience themselves. And I think that's a really important part of why it is so essential for us to co-produce alongside people with lived experience, co-deliver projects alongside them, and use their voice, amplify their voice, so that we are really learning about what it is like and what good looks like, so that we can take that forward in delivering better outcomes for people with learning disabilities, autistic people, and those with neurodevelopmental disorders, which is, of course, why we're here, and that's why CANDDID exists. But it was lovely to sit in a room with a group of people who were excited about what they did, who valued what they did, and who have been involved in the project since 2024 and are showing up time and time again to take part in it because they recognize that their contribution is hugely valued and integral to that. So I felt very privileged to be in the room.
It's lovely, Maddy. Thank you. And I think I've seen that presentation at previous conferences, and it does feel it's a very powerful experience actually being in that session. Just reflecting on what you were saying, and also linking back to what Ken said about the fact that we're bringing lots of different people and lots of different stakeholders into the room. So clinicians, academics, parliamentarians, and service users. What do you think, or how do you think CANDDID does that so effectively? There doesn't feel like there are barriers in the room. The flow feels genuinely very natural. Just wondered, what do you think is the key to that? What do we do well, I suppose, and maybe where we could go in the future?
I don't know what is the unique thing. I'd like to say that it's just that the door is open, that we try to be inclusive, that we aim to put on events that enable people to come where we have thought about their needs and we do our very best to meet those needs. It's difficult in a room with 300 people to get everything right for everybody, but we have breakout spaces, we have quiet space, we have a prayer room as well today because obviously we're in the middle of Ramadan. Um, I think it's I think it's about approaching things with that open door. And what we hope to do all the way through that is to welcome people to work collaboratively with people, whatever their professional, personal capacity is, and to listen. And I think listening is probably the most important thing that we can do in the space, and valuing everybody's contribution, whether that's from a personal experience or from professional experience. And I hope that everybody in the room feels able to speak up and feels that when they do speak up, their contribution is valued, because certainly the people that I work with really do value that.
On that point is that for me, it's about personal relationships. And I think that it's something that Candid has really worked on and profited from by using the personal context and developing the relationships. And even with new people, what the new people don't understand when they contact or get in touch with Candid is that uh, they're almost trapped in it because they're not going to get away from this web of Candid. It just follows you wherever you, but it really enhances the connection, and it is the personal relationship. And it's not just meeting one person, because you meet one and then what about my colleague here? You're going to meet them, so you get to know people quite easily. The other thing as well, which works when you work in services for people with learning disabilities. It's all about the positive, what the person can do, and not so much kind of deciding, what they need support with, but it's actually about encouraging people. And I think you are transposing that from your clinical work into Candid, as in it's medical is an open door. It's a very open environment. It's a very accepting environment, and it's about, well, what can you contribute to us, and what can we help you with? That's very apparent once you get within the web of Candid.
Is it a web? Is it a labyrinth? I would say that we are trying to create a community where every voice is valued, and where people feel able to contribute. And for me, there's something about enabling people to contribute, and to contribute the things that are important to them. And if we get that right, then we have a really rich theme of ideas and experience that we can use to inform our agenda, which at Candid is about research, education and training, so that we can deliver better outcomes for people. So yeah, web, community, which way do you want to go, Ken?
Um, it certainly is a community where ideas can flourish and where ideas are actually encouraged, which is, for creative people, it's a really great environment. And it seems as though every idea that you have is not insignificant. It is valued. It may not appear to go anywhere at the beginning, but it is being picked up, I feel, with this. And this is me speaking about it from someone who's not intimately inside Candid, but on the periphery, and feeling it and observing it at the same time. And in some ways, I'd like to think I've come along the journey with Candid since its preconception days to where it is now. And it's a model which you have. It's a model which would be wonderful to replicate. But having said that, you could never replicate it perfectly, because it was really dependent on very much the ethos and the personalities involved and the personal relationships that are generated. But it's people should be looking at it objectively and saying, could we do this elsewhere? I don't know if Canada is in a position to do it nationally, and that's a debate. So would you lose something if you were to do that? But I think your big strength is what you've done here in the Northwest. So people are paying attention to the Northwest, which is fantastic.
I think that's really important. And I think one of the, what you say about not being able to replicate it, we can't replicate us as all as individuals. Well, I would say in a perfect world, but that really wouldn't be a perfect world for us to do that. But I think what we can do is we can learn some of the lessons, and then it's about us as Candid, how we disseminate that to help facilitate other people to be able to do something similar. I think that's one thing that we'll be taking away from this Candid conference, to think about, could we put together a bit of a blueprint about how people can engage really truly, rather than it being tokenistic. I've certainly seen, even just within the past year, the difference in how the service users in the room experience the conference, and how they engage with some of the sessions. So I think if we can produce that in an authentic way, I think that's going to be really important for people to take that forward. Sorry, Maddy, you wanted to.
No, I was just going to say, I mean, I think it's a range of speakers as well that we're able to attract these days. I mean, this morning we had a talk from Baroness Browning about the Autism Act and the development of the next autism strategy, which should be published by the end of this year. That will be a national autism strategy. And I sat there thinking about how much of the Autism Act promise has not yet been delivered, although there is definitely a change. There is definitely a change since it started in 2009. But she was talking very much about, how do we measure progress? How much do we, are we actually ambitious in our language, but we are not ambitious in measuring how far we've got? I think Professor Tom Shakespeare was able to tell us about his thoughts about human rights and his hopes for the future, particularly in light of the 10-year health plan, which is an unprecedented opportunity for us to think differently around prevention and around community-based services, and a real opportunity, if we handle it right, to address those underlying health inequalities that mean that people who are seen within mental health services don't necessarily have their wider needs met within universal acute or community-based services. And for for autistic people and for people with learning disabilities, there is a huge piece of work that we need to do collaboratively with both primary and community universal healthcare services to address those barriers. And I think that there is fertile soil for us to work on, but we need support from the research community to identify what works, so that what we aren't doing is spending lots of time developing small little projects that may or may not be effective. Part of the role of Candid that I can see is about identifying what really works and then um, enabling us to use that as a blueprint moving forward. But that's through evidence-based research. And those are spaces that I think if we work together collaboratively, with other institutions and with other NHS organisations, we might be able to have a level of traction that we haven't seen so far, based on the outputs of leather, etc. There's something about the so what, which I'm really, really keen for us to think about moving forward.
Thanks, Maddy. I think you've just perfectly and succinctly given an overview of the presentations that we had this morning. So thank you for that. That was really, really useful. And I certainly, I think most people in the room, or if not all people in the room, heard the call to action from Baroness Browning about how we actually deliver and continue to translate research into practice, and how it's all of our responsibility to continue to do that. Any final reflections from you, Ken?
I was just picking up what you mentioned there about Baroness Browning, which brings it home to me that we all have our part to play, and she has an important role, and one that, in some ways, in Candid, we always, when we're busy doing the work at the front line, we don't even think about the other characters who could actually help what we want to do. And going back to the earlier comment about replicating this model, the core feature of it would need to be, in my opinion, there is the lived experience. If you don't have it, it's not going to work. So why bother? So it's the lived experience you have to have there.
That's great. Wonderful way to round up the podcast for today. I'll let you both get back to the conference now. See you all soon. Thank you.
Thank you very much.